Hello and good day to my module supervisors and everyone watching. I'm Shivashni Silvanathan, a first semester student of the MSc Molecular Medicine ODL part-time program from IMU. The title of my research proposal is Progression-Free Survival of Patients with Advanced Epidermal Growth Factor Receptor EGFR Mutated Non-Small Cell Lung Cancer treated with first-line osimertinib versus gefitinib in Ministry of Health hospitals, a Malaysian multicenter study. This will be the flow of my presentation today. I will start with the background of my research topic. A little introduction on lung cancer types and mutations. Lung cancer is not only the third most common cancer in Malaysia, but also the most fatal one. If you notice from the title, my study focuses on a particular group of lung cancer patients. Now, to shed some light on this group, non-small cell lung cancer, or the widely accepted abbreviation NSCLC, is the most common histological subtype of lung cancer globally and also in Malaysia. 40% of all Malaysian NSCLC patients harbor the epidermal growth factor receptor, which drives cancer cell growth and survival. On top of this, sadly, 95.4% of all lung cancer in Malaysia are diagnosed at late stages, which is stage 3B, where cancer is locally extensive but did not spread beyond the lungs, and stage 4, where cancer is metastatic and has spread beyond the lung structures. In these advanced stages, treatment intent is not curative but to control the disease only. This distinction is very important as curative intent usually focuses on different treatment strategies such as surgery and radiotherapy. So to re-emphasize, my research will focus on advanced EGFR mutated NSCLC patients where treatment intent is to control the disease. This is where the EGFR tyrosine kinase inhibitors TKI comes into the picture. It was discovered and introduced to inactivate the EGFR mutation and improve patients' progression-free survival and prognosis. Unfortunately, over time, resistance mechanism towards the older generation TKI, namely the first generation gefitinib and the second generation erlotinib, developed due to a new mutation, the T790M mutation. This was evident in Malaysia as well. A recent 2024 study showed that 69% of lung cancer patients developed the T790 mutation, and this is where osimertinib, a third-generation TKI, enters the picture by targeting the T790M mutation and bypassing the resistance mechanism. This pushed osimertinib forward as the preferred first-line therapy in this group of patients. The problem, however, is only 12.5% of eligible Malaysian lung cancer patients receive osimertinib, while the majority are still treated with older generation TKI. This is due to formulary restriction, where only first generation gefitinib is listed in the Ministry of Health Medicine formulary, which dictates which drugs are available free in public hospitals. The reason for this is the cost-restrictive setting of most developing countries, including Malaysia. There are strategies to increase the adoption of osimertinib in cost-restrictive settings, such as lowered doses, patient-assisted programs, and generic substitutes. But to encourage a broader adoption of osimertinib as first-line therapy in clinical settings and in policy making, data from real-world and local settings to support the superiority of osimertinib in improving progression-free survival is vital. This data is limited globally and not available to date in Malaysia. But it is crucial as treatment response may vary in developing countries due to differences in socio-economic demographics. Malaysia's multi-ethnic setting may also influence treatment response due to genetic variations, and the discrepancy between our clinical practice in public versus private healthcare in Malaysia also contributes to the need for more local specific data. This study aims to compare the progression-free survival, an important oncological endpoint, and the demographics that improve progression-free survival in advanced EGFR-mutated NSCLC patients treated with first-line gefitinib versus osimertinib in Malaysian public hospitals. The significance of this study is a broader adoption of osimertinib as first-line treatment in Malaysian advanced EGFR-mutated NSCLC patients, resulting in better disease outcome. Next, to go on with some literature review to further support the research topic, I've divided my literature review into primary data from trials and secondary data from observational real-world studies. The two pivotal trials that are the IPAS study in 2008, which established EGFR TKI as a superior option in terms of longer progression-free survival, improved tolerability, and enhanced quality of life compared to standard chemotherapy. Fast forward to almost a decade later, the discovery of osimertinib and its proven efficacy over older generation TKI was shown in the landmark FLORA trial, which shaped the current preference of osimertinib as the first-line treatment with almost double the progression-free time of 18.9 months in the osimertinib group versus 10 months in the gefitinib group. Real-world data from developing countries are limited, but one noteworthy multi-center retrospective study in China last year demonstrated similar efficacy of osimertinib as the FLORA trial. In Malaysia, there is no published literature on progression-free survival of osimertinib as first line. However, there is a 2024 study done which demonstrated similar efficacy of osimertinib even when used at lower doses. This study, however, focused on patients receiving osimertinib as second-line treatment. Moving on, the null hypothesis this study is attempting to reject is that there is no significant difference in the progression-free survival of advanced EGFR-mutated NSCLC patients treated with first-line osimertinib versus gefitinib in the Malaysian public hospitals. The general objective of the study is to compare the progression-free survival between patients receiving osimertinib versus gefitinib as first-line treatment in advanced EGFR-mutated NSCLC, and the specific objectives are to describe the demographics of these patients and to identify the prognostic factors that improve the progression-free survival in local settings. Moving forward to the research methodology, this is an observational multi-center study using a retrospective cohort design and purposive sampling method. All patients diagnosed and initiated on gefitinib or osimertinib during the recruitment period of 1st December 2018 to 1st December 2022 will be identified from the pharmacy registry of respective study sites. These patients will be screened for eligibility via the electronic medical records (EMR) based on the inclusion and exclusion criteria. Selected patients will then be grouped based on their treatment, gefitinib or osimertinib, and follow through their EMR until disease progression, death from any cause, loss to follow-up, or until the data cutoff date of 1st December 2024. Baseline characteristics such as gender, race, age, ECOG performance, which is performance status of patients based on the ability to perform activities of daily living, family history of cancer, EGFR mutation type and stage of disease, as well as TKI initiation date and dose, and drug toxicity and concomitant illness will also be collected from the EMR for analysis. The inclusion of only study sites that uses electronic medical record and not manual recording is intended to help minimize information bias as more standardized data collection can be achieved. These sites are Institute Cancer Negara, Putrajaya Hospital Kuala Lumpur, Hospital Pulau Pinang, HSI JB, and Hospital Umum Sarawak. For data analysis, the SPSS software will be used. Survival analysis methods to assess progression-free survival will be employed. Kaplan-Meier curves will be plotted for each group, osimertinib and gefitinib, to evaluate the median progression-free survival, and a log rank test will be used to compare the progression-free survival. Cox regression analysis will be used to assess prognostic factors influencing the progression-free survival, and a value of p less than 0.05 will be considered statistically significant. Propensity score matching will also be employed to minimize selection bias due to the imbalance of number and sociodemographics of patients on gefitinib versus osimertinib. This is because patients on first-line osimertinib are self-paying patients, hence limited in our public hospitals, compared to the fully subsidized gefitinib patients in public hospitals in Malaysia. The primary endpoint in this study is progression-free survival, defined as the time from the initiation of TKI therapy to either evidence of disease progression or death from any cause. Disease progression is evaluated using the response evaluation criteria in solid tumors, also known as the RECIST 1.1, which classifies disease status into 4 categories: complete response, partial response, stable disease, or progressive disease, which is based on interim CT thorax, abdomen, and pelvis findings, which is typically done every 6 months in this group of patients. This is my Gantt chart for my study. And lastly, these are my references. Thank you all so much for all your time and feedback. Thank you again.